So here we are, and on the eve of Stanley getting cataract surgery. And I wanted to ask you a few questions about how you feel about it, what you're thinking about the procedure, so that we can share that with others who are perhaps considering cataract surgery. So, tomorrow you're going to get laser surgery on the eye with the cataract. So, tell me what led up to that.
Well, what happens is your sight begins to diminish slowly. With me, it was just things become a little bit blurry. Now, even driving, although I can still drive and I'm permitted to drive, the signs, you have to be closer to the signs to read them. Now, you can still read them, but you must be like close. And another thing that affected me was reading. Now I use a large print, in this case, New Testament and Psalms. And so it over the years it gets steadily, gradually, a little bit at a time, it gets worse. So I thought about it for a few years, and now it's time because if I don't do it now, I may never do it. And I could get to the place where I'd be completely discouraged from reading and then not driving, and that would be a disaster. So we made the decision, let's do it.
So, in the process of everything leading up to the time when the optometrist said, okay, now your cataract is actually ready to be to have surgery, at any point in time, did you feel frustrated with any of this?
No, I never felt frustrated. I just felt someday at last, the regular optometrist has said, because she had said for years on and off that you're not ready yet. And then my last visit, she sat down and looked at me and said, that one in the left eye is ready for cataract surgery. So we'll book you an appointment with Medical Way in Newmarket and get it moving.
So, at no time did you find yourself getting frustrated because you couldn't read road signs until you got to a certain level of closeness to them, or with your reading, like you're reading a large print.
Well,
That
you've
didn't,
asked me two questions there. One is with driving, not really frustrated, except I decided that I'm not going to drive at night when it's raining
right?
because there's too many reflections and too many things you're not sure sometimes if they're in your way or not, and that's not good. So any night driving I do, which is minimal, is done when it's dry. And your other question was about reading. Yeah, sometimes a little frustrated. There's a nice encyclopedia book I use, a study Bible, and the print is kind of small, especially in the references at the back of the book. And I couldn't hardly ever read them, but that was frustrating. Yes.
Hmm. So, how did you deal with that frustration?
Well, I'm dealing with it now.
Okay, so you're saying that it was probably 2 years since they first discovered the cataract to
Oh,
now?
longer than that.
Longer than that.
Yeah, I'm guessing. See, cataracts take a long time to grow, and I'm guessing it might have been 3 or 4 years ago when first they noticed it before I did because they can see through a lens that I'm not privileged to see through.
Their special camera work and stuff that they have.
Yeah,
So, at a certain point, you began to notice that things were getting a bit worse. You went to the optometrist and she said, "Yes, Stanley, you're right. It is ready to get removed or to deal with it."
yeah. So we have an appointment with Medical Way in Newmarket, and they're skilled laser surgery people. So we've heard good reports about them, and apparently they're very. It's not a long procedure. It's just to get everything ready, and then they remove the cataracts. I don't know. I'll know better when I go through it exactly what they do, but they remove the cataract somehow, and then they put a new lens in your eye. That's all ready to go.
Okay, so you are now the day before surgery. This is Thursday. Your surgery is March 1st. That's tomorrow morning. And you have to leave the house here by 6:30. Your appointment's at 7:30. So in other words, it's out of town. What do you do to prepare?
Well, sometimes it's simple things. I just, well, get out of bed, take a shower, get ready, and uh,
Like, can you
get
have breakfast?
no. There's no breakfast. You're not allowed to have any solid foods if you have an early surgery. You're allowed to have. I'm going to take water, a bit of water, and some applesauce, a little bit of applesauce. But there'll be
Which
no.
they allowed.
Yes,
What about your existing medications?
existing medications are just they need to have them on hand because they're MDs, and if anything, say uh, one of their patients had an upset of some kind, then they can check their medications and see it might help them to understand what's wrong.
So what you're saying is you have to take those
You have to take
medications,
them. I mean, I won't be using
I
them, and
mean, to show them.
yeah,
Yeah, bring them along.
if they ask, yeah,
But at morning, you take some certain medications in the morning. Will you be able to do that still?
I will, but it's too early because we're leaving at 6:30. I take those uh, to a low dose aspirin and a metoprolol. I take those at about 7:30, so I probably won't take them till after surgery. Those
And
two little pills.
the metoprolol is a medication that was required following heart surgery that you had about 15 years ago.
Yeah,
Yeah, amazing, eh?
yeah. Metoprolol helps heart rhythm, slows it down, lets it speed up.
But some people, when they're anxious about something, their heart rate speeds up.
I don't think I'm not anxious about this really at all. It's just I look at it as an adventure because it's highly recognized. It's safe. It does the job, and it usually lasts the rest of a person's life. Because cataracts are removed when people are a little bit older, and they will live with the new lens in either one or both eyes for the rest of their days.
And March 8th, the following week, you get the other eye
Yeah,
done.
the right eye will be done.
And they said in the consultation that happened before, about a month or so ago, they said your eye requires a certain kind of lens called the toric lens,
Yeah, both eyes do.
which costs a little bit more.
Yeah, but I don't really know what that means, but they figure by the way the shape of the eye and the shape of the pupil and all that stuff that it has to have this special toric lens. So we just believe them because they seem to be credible people.
This might seem like a strange question, but do they take off your existing lens and put a new one on?
I don't know the answer to that question. I will next time. Maybe tomorrow, maybe the next day. I don't know the answer. I'll be guessing.
So we'll definitely do a follow up then.
Oh, for sure. Have a bit of fun. And hopefully I'll have no glasses on. And although if it's a bright day, I may have shades. You have to wear sunglasses at least when you go outside for at least a week after surgery.
Because your eyes are healing like
Yeah.
any surgery, and they will be sensitive to
I,
light.
and for sleeping, you have to put a special patch on whatever eye has had surgery. So first of all, it'll be the left one for a week, and then it'll be the right one for a week. Anyway, we're all new at this. We're just talking from experience of some things, how you arrive at that destination, and then we're kind of guessing some of the real technical stuff because I have no idea.
Although we did watch a video, and the initial video we watched was laser surgery versus the surgeon just going in with his tools and cutting slits into the eye and so forth. And that's why we decided to do, or you decided to do, the laser surgery.
Yeah, although the other one using his tools and a special little knife is still used worldwide and has been very successful because you have to have skilled hands and well trained to use it. But yeah, they told me down at Medical Eye that their doctors use it every day and do surgery that's not laser.
But after watching the video and we saw the laser, we realized it was more precise. The healing is faster.
Yeah.
And they say there's no pain with either procedure.
Well, we'll find out.
It's now 7:12. We're on our way. Newmarket. How do you feel?
I feel fine.
Yep. You're looking forward to this?
Well, I'm looking forward actually to, yeah, just submitting to the procedure and see it doesn't last very long. And then begin to learn what to do about the eye patch thing and the sunglasses and what you can do, what you can't do for a week. And then that week is up to get the other eye done. And after a week, I should be hopefully all back to normal. And normal, of course, will be enhanced from what it was.
You're a new normal. No glasses.
Now, wouldn't that be some?
And 4K vision.
I can hardly think of wearing no glasses every day. I've worn them for over 30 years.
And then your chin up. And you're going to look up at the ceiling. Good. Doing the left eye surgery. Blink, blink, blink. And then you can wipe your eye. And I'm going to put one more dilating drop again. This one stings a bit. Blink, blink, blink. And then you can wipe your eye. Should be fine for me to take your blood pressure. I'll try.
Okay, all right. Yep.
And then when I put your IV in, I'll ask you to push it up. Okay. I'm just gonna put your hand here and finger from the side. Thank you. And then move this closer so you're getting comfortable. I'll tell you when.
Okay. You looking for the vein?
Yeah, I see two. I'm trying to choose which one I like more. The bigger, the better. I'm gonna pick this one. And I'm using a smaller one.
You need me to.
No, you don't have to make a fist. And I am going to use a smaller needle for you, okay? And we're going to go through it right now. Do you want to come so you can see the chart while I go through it?
No, I'll read the chart, but as long as I can hear you. And then I'll look at the chart later, but so this is just to clarify in case we need that. So.
Okay. So you're going to take 3 different drops after surgery. Vigamox is an antibiotic. Today is your surgery day. Once you get home until you fall asleep, 1 drop every 2 hours. Tomorrow for a week, 1 drop 4 times a day, morning, afternoon, evening, night. Okay. And then after that week, you don't need to take it anymore.
Okay.
Next one, Lotamax, anti-inflammatory, same thing. 1 drop every 2 hours today.
Can those 3 be taken together?
They can, but you gotta wait 2 minutes in between your drops, and it says that over here.
All right.
So 1 drop every 2 hours today. Tomorrow for a week, 1 drop 4 times a day. Every week after your surgery, you're decreasing it by 1, and you have 2 boxes.
You have what?
You have 2 boxes
2 boxes.
in here.
Okay.
Your last one is Prolenza. It's an anti-inflammatory. You don't need to take it today. Start tomorrow for the next 4 weeks, once a day. It does not matter what time.
Okay. It's a lot of points, a lot of information.
That's why I'm videotaping it.